I'm going to be talking about what I consider the three hidden drivers of HS. So, this was a statistic from a recent study that showed that 55% of HS patients on medication are actually getting better, significantly better, which I'm sure this is your lived experience. That's not necessarily great stats. Yeah. So, I want to tell you a little story about a client of mine. Her name is quote unquote Sarah, because out of respect for her privacy, I've changed her name and likeness because when I work with people, confidentiality and their trust is really important to me. So when she came to me, she was also struggling with HS and feeling anxious, overwhelmed, feeling really frustrated about the physical pain that she was experiencing and the emotional weight that she was carrying around about her condition, constantly feeling like she had to hold it all in, couldn't really share how she was feeling like a burden to those around her, and not really feeling safe enough. I think I've heard this echoed, not really feeling safe enough to talk about what she was going through. And then on top of that, the exhaustion of trying to juggle everything that she was personally experiencing with family and work responsibilities. And so when she came to me, um, she really wanted to help manage some of this overwhelm and anxiety and really wanted to heal, but she didn't really know how to do that because she had believed that medication probably was her only option. But it hadn't worked in the way that she had hoped. She was in that statistic. Um, and she'd also been told, I think, like I've heard many of you share, that if she had just lost weight and changed her lifestyle, that things would improve. And she had tried that, and it really wasn't as effective. Um, and she also didn't necessarily believe that how she was feeling about her condition and the stress that she was experiencing had anything to do with her skin. And I will name that I was also one of those people who didn't believe that our mental health and our skin health had anything to do with each other until about 12 years ago when my own health came crashing down. So, as a dermatologist, I was a skin cancer and melanoma specialist. And about 12 years ago, my own skin started to change, dry, irritated, all these pigmented lesions started to grow and change. I was getting biopsies every couple of months until I found one that was incredibly atypical. And had to diagnose it as early melanoma. And that was just the tip of the iceberg because then I was dealing with gut issues, hormonal issues, and my health really started to spiral. Several surgeries, wound up with a hysterectomy, and threw myself into early menopause. Um, and so I too had gone to doctor, looking for solutions, getting different diagnoses, lots of different pills, and all I wound up with was more side effects. And it wasn't until I dove into learning about mind body medicine, nervous system health, that things really started to change. And that really changed the trajectory of my life. It really led me to writing my book, The Skin Whisperer. It led me to speaking to healthcare professionals and people like you so that what I learned I could pass on so that you don't have to continue to suffer. It's become my life work. And I know that you're here because you have your own life work. You have dreams and ambitions, and you're here to make a big impact on people in the world. Um, but skin issues, I'm having trouble with eh, this is not working. Uh, no, let's see. But I can't see. Nope. I'm cheating, y'all. I'm looking at my notes. Um, So, I know living with a chronic skin issue can affect, your life in a way, and we started this day with crossing the line, right? You all were crossing the line, and I would imagine that I know for me, I don't have HS, but I learned at a very young age because of birthmarks that I was born with, and I was bullied for them, and people called me coffee stain face, and there's a lot of shame and embarrassment, and I learned at a very young age that our skin could be a source of humiliation, right? So I know that there was walking across the line of anytime, if you've experienced, you know, not going out on dates or seeking relationships because of embarrassment of your skin. Yeah. Not putting yourself out there because of how you feel. Maybe, when you have a chronic or visible condition, it doesn't just affect you, it affects your relationships. And we talked about intimacy. So this can have a significant impact. So I wanted to make sure that at the end of today, you have a lot of clarity about the things that may be contributing. One of what I believe one of the biggest drivers of your skin condition, all skin conditions, and exactly what you can do about it so that we can improve the outcomes that you're experiencing. So maybe, like Sarah, you've been told that, medications and skincare products may be the only solution to heal your skin. And listen, skin care products and medications do have their place. I know that the new biologics, they have been game changers for some people, but even as a physician, I'm not trying to poo-poo the pharmaceutical industry, but most medications are geared towards symptom suppression, right? They can help put out the fire. They're very necessary, especially when you're in pain, but they are not getting at the root cause of what's driving or starting that fire in the first place. And oftentimes, if you go off the medication, your symptoms come back. You might have also been told or led to believe that just changing your diet and lifestyle or losing weight or healing your gut will resolve your skin issue. Um, I don't know how. Are you able to help me with my notes? Um, and to a certain degree, this can be really helpful. There is a lot of evidence. I want to be able to just move like. I know it doesn't want to do it. Okay.
So you can't look, you can see only so much.
Yeah.
Oh, that's helpful.
Sorry, I should be. And this is how it goes. We're going to be talking about stress and nervous system. And here we go. This is a perfect life happens for, things happen in real time.
No, just keep moving you.
On that screen? I'm back. Honestly, I don't know if it'll let you in.
And now we can't even go back. Dun, dun, dun.
Okay.
Oh, you're giving away all my slides.
Oh,
You're
oh, yeah, like-
missing the big moment.
Okay, now you should be able to go all the way back, and now you can scroll down on this side, however you need to.
Oh, okay,
That work?
cool.
Yeah, that's what you wanted?
Yeah, that's what I wanted. Yay! Okay. Sorry for the brief interruption. Back to the program as scheduled. So the old science, things that have been disproven, right? Medications, not poo-pooing them, but we need to do more than just put out symptoms. Diet and lifestyle, helpful. You've heard this before. You've tried it. Probably hasn't worked as efficiently. And there is a mountain of evidence on the benefits of a nutrient-dense diet, on skin health, on overall health. There is a mountain of evidence on the importance of sleep on skin health as well. And with all the research on the gut microbiome, it makes a lot of sense that we would be told, focus on gut health, right? Especially when there's that Hippocrates quote that all disease begins in the gut. But my question is always, why does it start there? Why does disease begin in the gut? What is causing that to happen in the first place, right? That makes your gut leaky, and then there's that gut-skin connection and all the inflammation. So we can use a lot of these lifestyle changes and implement strategies and tactics, But if we're not addressing why those habits are being formed in the first place or why things are going awry in the first place, then it's going to be hard to make those changes last. Or maybe you've been told that, or maybe it's because in medicine, we are also subspecialized and we silo parts of the body, and we treat them separately, that you've been led to believe, or you've believed for yourself, that skin health and mental health are totally separate. And as our most visible organ, when things show up on our skin, it's on display for everyone to see, you know? And when we live in a society that puts so much value on our appearance and as a metric of our worthiness, it makes so much sense that we would feel anxious and worried, right? In fact, I know one of the questions this morning was, how many of you have felt embarrassed about your appearance, right? Well, there was a study that was done in the UK that showed that 98% of people reported that their skin issue affected their emotional well-being and affected their self-esteem. 98%. And I can guarantee you that those stats are the same in our country as well. Right? Mental health and skin health are intimately connected, and they can have a bigger impact on us, on our overall well-being than we might realize. So I want to dig into why this is, and you kind of got a little preview. And that's because what you might not know is that your brain, your skin, and your nervous system are all derived from the same layer of embryologic tissue. There's an intimate connection, and they are talking to each other constantly. I tried to keep it cool while the technical stuff was going down, but my pits are really sweaty. My palms are really sweaty. I'm feeling a little uncomfortable, and that is my brain and my skin talking to each other in real time. Yeah? So this intimate connection creates a two-way communication between our brain, our skin, and other parts of our body, including our immune system, our digestive system, our endocrine system, all of which have a direct impact on your skin. So understanding this connection is crucial because your skin and your nervous system and your brain all work in tandem. And dysregulation of your nervous system can be a root cause or a consequence of not just skin diseases, but all of chronic illness. And it's a two-way street because our skin can affect our mood and our mood can affect our skin. And it becomes this very vicious cycle. So recognizing this cycle is the first step towards breaking it and moving towards healing. So I just want to get a show of hands. How many of you is this the first time that you're hearing that your skin and your brain and your nervous system are together? Or are you very familiar with that concept? You're very familiar with that concept. Excellent. Because I will name that even though I am a trained dermatologist and we learned about the mind-skin connection, the impact and the far-reaching impact of it, I wasn't aware of until I did additional training and really dove deep into this. So I'm glad that y'all are light years ahead of where I was, right? Um, because the bottom line is that because they all work in tandem, in order to fully heal, we have to learn how to attend to how our mind and our nervous system are functioning. So what does having a regulated nervous system actually mean? Nervous system regulation refers to our ability or our capacity to handle stressors with enough ease to be able to come back into what we call homeostasis or balance after we experience them. Regulation doesn't mean that we are chill and calm all the time. What it does mean is that we have the ability to experience those highs and lows without being catapulted in one direction or the other. It's more like riding a wave so that we can come back into kind of our baseline. It's really about cultivating resilience. So I want to just talk about how this might look in real time. So this is my ode to a tree stump in the swamp. When a lot of, I primarily have worked with women, and when they come to me, a lot of times they're dealing with all sorts of things. Anxiety and panic attacks is a big one. They're not sleeping. They might have headaches and digestive issues. Skin issues are flaring. Maybe it's their acne. Maybe it's their hidradenitis. And because the brain and the skin are so intimately connected, there's a lot of negative self-talk, a lot of people-pleasing, perfectionism. To cope with that, there's a lot of over efforting. Maybe there's over drinking, over Netflixing, and social media scrolling. And I will name and call myself out 12 years ago. I could have ticked off like almost all of those, right? And then there are times and I still do. This is not like I am not like I am healed, I am done. I am like I'm recognizing now that I can easily pick those things out. And so one of my favorite professors always used the analogy of a tree stump in a swamp because you can see things that are on the surface, but you don't know how deep it goes because you don't know where the roots are. And the same applies for skin health as well. Most skincare treatments are addressing the symptoms that we can see. We're suppressing what we can see. But what you're not seeing is the root of where it's all coming from. And what's really driving those symptoms is that inside we don't feel safe. Even though there's a ton of research all about the long-term effects of chronic stress, what we're not taught is that the root of all of those symptoms is that our bodies are kind of living in this survival mode because our nervous system is dysregulated and it's making us feel unsafe in our skin. Because there is a deep primordial theme that's wired into our DNA, which is slowing down, connection, and a felt sense of safety. And creating a felt sense of safety is fundamental to our survival, and it takes priority over the other two. So I want you to think of your autonomic nervous system like your personal surveillance system. It's always looking out for your best interest, looking out for perceived threats. So it's always scanning your environment, your internal environment, your external environment, looking for cues of danger to your physical, your mental, or your emotional well-being. Always ready to activate in service of your survival. And depending on your lived experience, your nervous system will respond in one or more ways: fight, flight, freeze, appease, or shut down. So your autonomic nervous system has two branches: your sympathetic nervous system, which is like hitting the gas, and your parasympathetic nervous system, which is like hitting the brakes. And your parasympathetic nervous system is controlled by your vagus nerve, which is further divided into your ventral vagus and your dorsal vagus complex. And I created a guide that I'll tell you about at the end that tells you all about that, so you can learn more about that. I love it. Bring it on. Um, but what you really need to know about your autonomic nervous system is that your body is always making subtle adjustments between your gas pedal and your brake to respond to what's happening around you and what's happening inside of you. And I just want to name that activation of your stress response is totally normal. It's an adaptive response, right, in service of our survival. That's your sympathetic nervous system kicking in with its fight, flight, or freeze mode to prepare your body to take action. And the parasympathetic system helps to calm things down, slowing your heart rate and breathing to help out. But there's this tension that exists, right, between our need for connection and slowing down and our felt sense of safety. So when there are moments or experiences that threaten our safety and it overwhelms our nervous system's capacity to handle it, when experiences that are happening that are too much, too fast, too soon, or are happening for too long with too little support, our body starts to sound the alarm bells, right? Your surveillance system is like, woo, 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 like danger, danger. And it sounds the alarm bells. And we can get stuck in our coping strategies with either our foot slamming on the gas pedal or pulling the emergency brake. And so, in either of these situations, is how trauma happens. And so, not in all circles, but the way I've learned about trauma is that trauma is anything that overwhelms our nervous system's capacity to handle it, that creates dysregulation in our nervous system. So, for example, as kids, right, we had to rely on others to have our needs met. But if we had caregivers who weren't attuned to our needs, or they, um, you know, didn't, our needs were neglected, and we didn't feel seen, heard, or understood or valued for who we were as we were, right? You were told to sit down, you were told to be quiet, you were told to be kind instead of being able to express big feelings or emotions, or maybe you were punished for showing anger. Or maybe your lived experience was that you witnessed or directly experienced physical, verbal, or sexual abuse, where your felt sense of safety mentally, emotionally, or physically felt threatened and kept your autonomic nervous system sounding the emergency bell and keeping your body in a state of survival. There was a recent study actually that showed that 91% of people living with HS had experienced one or more traumatic events, with emotional trauma being the most common. But maybe that isn't you, right? Maybe you came from a very loving home and had all your needs met, but trauma can also happen in the medical setting. We heard a story last night of someone having recommendation to have their breast removed, and it was a procedure that was essentially unnecessary. There's a lot of situations in dealing with medical issues that can be very overwhelming or confusing. Getting a chronic diagnosis, requiring surgeries or procedures, and the complications that may result from them, or even interacting with medical professionals who just don't get it, who just don't get you, and you don't feel seen and you don't feel heard, right? All of these situations can create a felt sense of you not feeling like you have a voice, choice, or power over what's happening and keeping you in a chronic state of stress. And so activation of the stress response, it triggers the release of stress hormones and inflammatory signaling that affects our nervous system, our immune system, our digestive system, our hormones, and our skin. And so all of our hormones are derived from the same building blocks. And so our body is going to prioritize our body functions that are going to help us get out of harm's way, which means digestion shuts down. Libido, someone asked about libido. That you don't need to be having sex or eating when you're trying to run away from danger. Yeah. So this is why that happens. And so because all of our hormones are derived from the same building blocks, we're prioritizing production of cortisol. So cortisol is going up. Thyroid hormone is going down, affecting your energy and your metabolism. Melatonin is going down, affecting your sleep, creating sleep challenges. Sex hormones are going down, estrogen and progesterone, creating a relative imbalance with your androgen. So if you've ever experienced challenges with period problems or PCOS or fertility, this is part of the challenge. While all of those hormones are going down, insulin is actually going up because in order to get away from danger, you need energy and fuel. So insulin goes up so you can generate more blood sugar, right? But if you're not actually physically running, right, where is that going to go? It's going to get stored in your body. And so if you struggled with weight issues, or if your diet and exercise regimens haven't been working, this is part of the issue. It's not you. It's like your physiology. You were going to ask a question.
Yeah. When you say insulin goes up, does that mean like it can make you pre-diabetic? Because I've actually been diagnosed pre-diabetic when my H's was at its worst.
So again, I don't know the whole picture, but it's possible that your body is so wise. So it was trying as best it could to do what it thinks it needs to do to support what it thinks you need. So it's very possible, right? When you're HS, there's a lot of inflammation. There's a lot of signals getting sent around. And so your body is responding. So it's possible. Yeah. Were you going to ask a question?
Yeah, or kind of following. I don't know if you're gonna get into it, but like, if you're outside, but like also not just the fight or flight response, right, where it's suppressing digest, but like how it impacts also the digestion, right? So like if you're stressed out, when you're
Shuts down.
it shuts down, and then that trickle down effect.
Oh, yeah. So that's going to affect your gut microbiome. There's going to be upgrowth of our bad bacteria, downgrowth of our good bacteria. That lipopolysaccharides are going to puncture holes in the gut lining. That's going to create inflammation. And then we know that has a role, especially in conditions like acne, rosacea, psoriasis. Yeah. So that's what's happening in your body. But stress has a direct response to your skin as well. And what most people may not know, we always think about the stress response as a top down, like your brain, the hypothalamic pituitary adrenal axis, but your skin actually has its very own stress response system. Your skin has its very own HPA axis, which means your skin is both a target and a source of the stress response. This is why skin is so fucking amazing and also so problematic at times, right? So what's happening is there's this inflammation. There's a primary stressor, mental, emotional, physical stressor, activates the stress response, release of stress hormones, causes inflammation in the body and the skin. You wind up with visible signs of inflammation. And that can affect our mood. It can create feelings of shame and embarrassment, which also creates more stress. And then we get into this vicious cycle, right? And it goes round and round and round. And when we are feeling uncomfortable physically because of the symptoms that we're experiencing, and we're feeling uncomfortable emotionally inside, what happens? We want to someone said it earlier, that you want to disconnect from your body. You don't want to feel that because it's really uncomfortable. So we wind up disconnecting from our bodies. We wind up disconnecting from our own selves. And if we're disconnecting from our own experience and our own selves, what do you think is going to happen? It's going to happen in other areas of our life, right? We're going to withdraw from other human connections. We're going to withdraw from experiences and opportunities in our personal and professional lives. And we may wind up feeling like we don't have that voice, choice, or power over what's happening. And we can make ourselves small or stay in toxic relationships because we don't think that there's another option for us, right? We can feel helpless. We can feel hopeless. So when we're living in a state of chronic stress, our dysregulated nervous system keeps sounding the alarm, driving inflammation, and driving or exacerbating your symptoms. So this is kind of one of the take-home points. When we're living in a state of chronic stress, you can't heal. But there's an upside of this, yeah? But this is also why, again, if your efforts, you're like, I've been trying all the goddamn things and it's not working, right? There's a good reason for it. It's not that you're doing it wrong. It's that when you are changing your diet and lifestyle, if there's still that stress response kind of fighting against, right, it's going to be challenging. So it's just that we've been missing this biggest piece of the puzzle. And this is why the advice that you see, especially on like social media, just change your diet, just do mindset work. Just we can't diet or supplement our way out of chronic stress, right? So because our brain, our skin, and our nervous system are working in tandem, we have to make sure that we're addressing kind of all the layers, attending to how our mind and our nervous system is working. We got to heal the foundation. So now that we know that our skin, to heal, we need to pay attention to our nervous system and help our bodies effectively release stress and work towards healing our trauma. There are 4 broader systems that we need to address. And as Riley mentioned, I have my own way of doing this called the Somatic skincare method. And in my methodology, we address all of that. And there's a 4-stage process, which I tried to do some animation and I'm not very tech savvy. There we go. So the 4 pillars are reveal, repair, restoration, and resilience. But what I want to get a sense of is where you're at with some of these pieces, right? So that we can start to sequence them appropriately. And so I want to take a minute and just like you can jot it on a piece of paper, or you can if I populate these, you can just take a screenshot and come back to it later. And I want you to rate yourself red, yellow, or green. So for instance, I understand my relationship to stress. If you were to say, I don't even think I'm stressed, right? That might be a red. If you're like, I don't really I just avoid stress at all costs, like that might be a yellow, like you know that you're stressed, or green might be, I understand I have stress and I'm open to like learning how to work with it or understanding how it's affecting my life. Um, I know what creates stress in my life. Again, if you're like, everything makes me stressed, right? You can't identify. That might be a red. Um, orange is like a yellow. It might be like, yeah, there's some things, maybe it's work stuff, but you're not as specific. A green might be like, oh, when I open my phone in the morning and I see 10 gajillion notifications, right? That's a green. I have stress coping strategies that are supportive, right? Rate yourself red, yellow, green. I know what stress in my body feels like, right? Again, I don't even feel stress. That would be a red. Kind of feel this vague sensation. Maybe it's a yellow. And oh yeah, there's this knot in my stomach or a lump in my throat. That's a green. I know what safety and calm in my body feel like. Red, yellow, or green. Right? I know how to identify what nervous system state I'm in. Do I know if I'm slamming on the gas pedal or if I'm slamming on the brake? right? Do you know how to identify that in yourself? Now, I know some of you may be still thinking like, yeah, I'm not stressed. Listen, this is I guess I should just use my own personal experience. I thought I had my shit together. So I was like, I can handle all the things. I am not stressed. This is not stress until my health totally crashed. And, you know, I learned what I'm about to share with you, and it all started to make sense. Because when no, yes,
Alright.
yeah, no,
So I would say like a lot of the time I'm not stressed, but then my body does certain things like picking, fidgeting. Are those like symptoms or signs?
those are your body's wisdom trying to help you navigate the stress that you're experiencing. So the picking, oftentimes, especially even pain, it's a distraction from the emotion that we're feeling, and it's trying to get us some relief. So your body's being very wise and trying to help you out. The question is, are those coping strategies supportive? Right? Red, yellow, green. Is it making it worse and causing me more pain? Does it make me feel good? Does it give me just a quick hit of dopamine? Or is it sustaining me? So yeah, your body is doing exactly what it thinks it needs to do, and now you get to be attuned and discerning. Is this something that I can want to continue to do, or am I going to offer my body something else? So, speaking of stress, right? What no one is really talking about is that there are three layers of stress that we need to address to be able to help our bodies turn the alarm system off. So, the outer layer, your skin is your ultimate boundary between you and the external world. So, this is, we do a lot when I work with people, we do a lot of boundary work, crossing boundaries. The skin is right, it's a metaphor for everything. But so, in our this is everything in our environment that affects our skin. So our external environment, like UV radiation and air pollution, for those of us who are older, yeah, like I'm definitely older. So, so I know you said that you're like the OG, but air pollution and UV are the uh, biggest culprits of visible signs of aging, right? And so personal and household care products that can be absorbed in our skin and increasing our toxic load. And we know like our relationship to social media, our interpersonal relationships, our internal environment, like how we sleep, how we move, how we eat. And we know there's mountains of evidence on a nutrient-dense diet, the benefits of antioxidants, and helping our skin health. Sleep is important, right? When we sleep, we generate melatonin, which is the most potent antioxidant our body can produce for skin rejuvenation and healing. And our body has a rhythm, but your skin actually has its own clock. So sleep is really important. And when you apply your medications is actually really important. So you can do all those things, but again, they may not have the impact that you want them to have because there's two other layers. And the inner layer of stress is all the things that we think about when you're stressed, like work deadlines, relationship conflicts, juggling family work obligations. And so things like journaling, affirmations, mindset work, talk therapy can be helpful here. But depending on what source that you look at, only 5% of our thoughts are in our conscious awareness. So that means that the vast majority of the things that our nervous system perceives as threatening or dangerous can't be accessed through talk therapy or mindset work. The last layer is the deep layer that is typically gets the least attention, but actually has the biggest impact on moving the needle forward for your health. This is a layer that is beneath our layer of consciousness, in our unconscious awareness. And again, depending on the numbers you look at, controls 90 to 90% of our thoughts that drive our behaviors and our actions. This is the layer that holds all of our unprocessed emotions, all of our lived experiences, your childhood wounds, your traumas. It's a layer that holds the wounds and the beliefs that have been passed down intergenerationally through our culture, through our patriarchal society that have been absorbed into our being without our consent or our awareness oftentimes. And these are they fuel our thoughts and beliefs like worry, shame, doubt, scarcity, and our limiting beliefs about ourselves, whether we are lovable or worthy, if we're a burden, if there's something wrong with us. They're also kind of driving, our limiting beliefs about our capacity to achieve things. And it's also the layer that holds all the times that you felt unsafe physically, mentally, emotionally, and didn't have the time, space, or support to metabolize and process emotions like anger or sadness or fear. But here's the thing, emotions are energy. But most of us don't help our bodies process our emotions. Rather, we suppress them or we avoid them. But in order to keep our nervous system regulated, we're meant to move that energy through, just like our animal friends do. Does anyone have a dog? Yeah. So like if there's a loud noise or thunder, what do our dogs do? They're like, pause for a second, and then they shake it out and they keep going. Same with deer in the headlights. Deer are a little more subtle because you have to get up close and you see they do like this little shake and then they move on, right? But what do? What happens to us? Instead of releasing the energy of fear or anger or sadness as kids, I know I was told to be quiet, stop that, sit down, just be nice. Just be nice. I didn't want to be nice, right? But what happens is we follow the rules and then we carry that conditioning forward into our adulthood. But when we don't metabolize and process our emotion, that energy has to go somewhere. Otherwise, it gets stored. And research has showed us that it gets stored as body memory. So there's we, it gets stored in body's memory, and then we kind of carry that around with us, and it weighs us down like a sack of bricks. And there's this saying that what we suppress gets expressed. And so our unprocessed emotions and our unhealed trauma gets expressed as tension in our bodies, as pain in our muscles and such, bloating in our bellies, and inflammation in our skin. So we need to be able to help our body release that energy in a way that your body and your nervous system understand, which is somatics. Somatics is a Greek word for the living body known from within, or knowing thyself, right? So it's an opportunity to embrace or know our wholeness. And somatics is an experiential approach to mind, to unite the mind and body, because the pain and the overwhelm and coping responses that are manifested by trauma, they take us away from feeling at home in our skin and create this internal divide. So we have to be able to talk to our body in the only language that it understands to help reintegrate our mind and body together, which is movement. It's movement of our body. It's movement of oxygen through our breath. It's the movement of sound through our voice. When we were babies, right? This is a perfect example. We communicated through our primal language of touch, sound, and movement, right? Everything was experienced somatically. So I just want to check in, like, how's this landing? Is that making okay? Hope, yeah.
So since having my surgery, I had it back in August, and I still find myself sitting in the same positions that I used to sit in when I was
Mm-hmm.
hurting.
Yeah.
So is that like the body memory and like the trauma that's still weighing on me? Like I even still come around and I'm like, is it coming back? So like, is
Yep.
that just the trauma and like stress?
That's your body has patterned. It learned a certain way, right? And this is where I think we were talking earlier about like neuroplasticity. Like your body is so wise. It had capacity to learn how to protect you. And now you can slowly teach it how to protect you in a different way by moving it, shifting it, teaching it, right? And but doing it in a way, not just telling yourself, like, just stop doing that. Because again, the way the body communicates. But yeah, so it's just your body's, it's been patterned that way. Yeah.
Mine's actually kind of like the opposite of that. I have a boil that's been under my arm for years since I was young.
Mm-hmm.
It's never closed. And
Mm.
it's been swollen and it goes up and down and swells. It never goes away. So I'm feeling like by the time I finally get that releasement of surgery, because I've never done surgery or anything to deal with my HS, that I'll actually like I will kind of be in a space of like body dysmorphia, like when you lose weight and stuff.
Mm.
I feel like I'm gonna be in a space where because I don't really know how much I'm really in pain. Because right now, I have pain right now, but because I don't really feel it, like I can walk around, I don't really feel it, or if I go like this, I feel it. I don't know what life is like without that pain.
Mm-hmm.
So I'm kind of like, I don't know what type of release that's going to be for me, how my emotions will change, how I'll be as a person, because I have literally internalized this pain my whole life. So right now, I'm probably going through the most excruciating pain that the next person will probably be crying about, but I wouldn't even know how bad that pain is or how much I'm internalizing it because I dealt with it. I don't know what life is like without pain.
Yeah.
Becomes part of your identity.
Yeah, I don't know what it's
Yeah.
like. So I know if once this happens, that's a whole new thing I have to relearn and
Yeah.
figure out within myself because then I feel like I may try to self sabotage myself to get some type of feeling.
Yeah. But there are ways, like knowing that awareness, it's brilliant. And thank your body for being able to get you through, to be able to cope with the pain, to be able to do this. You have been amazing. And imagine life on the other side of that without pain,
Can't wait. I don't know.
right?
Like,
And so you're just going to have to, it's going to be an exploration. It's going to be an adventure hunt. I think we were talking earlier, like an adventure. You're going to have to explore, and what might I do to feel, right? That aliveness. What if your aliveness, you know that you're alive now because you feel pain, but what if your aliveness could be experienced by feeling pleasure, right? Right? We just had a whole lecture on like all the ways that we can try and experience pleasure, either by ourselves or partnered, like going out on hikes and walks and being in nature. Like there's so many different ways. So it's understandable. That's a completely normal response to have. Of like, I don't know, maybe I'll self sabotage. Maybe you won't. Maybe you won't. But it's important to know. Sorry. Um, okay. So basically, your symptoms are your body's way of communicating with you. And this is where I really want to highlight and emphasize this. The reason why I keep emphasizing the body is because only 20% of what's controlling our nervous system signals are coming from the brain to body, which is why talk therapy alone doesn't work. 80% of the signals that are controlling your nervous system are from your body to your brain, which is why we need to speak in the language that it understands. Because if our body is sending 80% of those messages with fear, worry, you can't think your way out of it. So I was going to do a brief practice, but we might not have time. We can do it during the smaller sessions, but to help you, I want to summarize. Basically, medication is very helpful. You've now understood that there's more to it. Hopefully, you feel a little bit more optimism and hope that all your efforts have not been for nothing, that we need medication. This is a both and strategy, but the and has been missing to help optimize results. That diet and exercise, so important, but we know why it's important, right? But we also understand now why maybe it hasn't been working because of the stress response. And hopefully you now also appreciate how much more intimately connected and the impact that mental health and skin health has together. And so I know that you might be thinking this may not apply to me and it's hard and all the things, but I want to make it super simple for you. I created this guide, this nervous system regulation roadmap, because one of the first things that you need to do to be able to improve that skin stress score is to learn how to track your nervous system. This is one of the first things I do when I work with clients. So I teach you how to do that. I also go into more detail about the parasympathetic nervous system and the two different branches. So you can begin to experiment and see, does this resonate with me? How do I feel about this? So I want to make it super simple to help you understand the process to begin the healing process. You're aware now, and give you some tools. So you can download that. And then I want to, oh, sorry. Yeah, I want to make it super simple. I'm very wordy. But I did want to share just while you got, oh, just tell me to move away. Just, okay. So I just wanted to follow up on Sarah. She was feeling overwhelmed and stressed and all the things. Didn't feel like she had the energy or support and didn't know. And so I took her through a similar, a much more in-depth process, but she started with what you're going to start with in that guide. And I'm happy to report energy improved, confidence improved, and her pain and her flares decreased. And so hopefully, I personally might go into the sex and intimacy room. I think it was very interesting, but If you do happen to come in to mind, great. If not, but you have questions, feel free to reach out to me. Happy to answer any questions that may come up. And I want to thank you so much for putting up with my technological difficulties, and for your time and holding space for this, because I know that this is not easy stuff because it kind of may bring up stuff or raise questions. But thank you very much.